In this video, we are going to go over the general characteristics of the cervical vertebra. So first of all, remember that it's only the first two cervical vertebrae, C1 and C2, that have their own unique features and their own name. So we're going to look at the atlas first. The atlas has no body or spinous process, which makes it quite unique. It has a superior surface that articulates with the occipital condyle, and that allows it to carry the skull and to nod your head yes. So the superior articular facet articulates with the occipital condyle. And remember that the occipital condyle is on both sides of the foramen magnum at the base of the skull. Like the other cervical vertebrae, the atlas also has a transverse foramen, but it does not have a body or spinous process. For the axis, which is cervical 2, it has a body and process like other vertebrae. And it also has a dens, which is also called the odontoid process. And the dens is the missing body of the atlas. But it's very important because it's the pivot joint for rotation of the atlas. And it allows you to rotate your head side to side in order to shake your head no. So notice it does have a spinous process, which is unlike the atlas. It has a transverse process, a superior articular facet, which would articulate with the atlas, as well as a small body and a dens. When we look at the thoracic vertebra, we see that it's T1 to T12. They increase in size and they articulate with the ribs. So some of the unique characteristics are that the body is heart-shaped with two small, what are called defacets or demifacets that articulate with ribs. And T10 to T12 have only a single facet, not two. The vertebral foramen is circular. There's long, sharp spinous processes that are kind of pointed inferiorly. So remember, it looks like the head of a giraffe. So that's how you're going to identify it in lab. For example, if you have an image with a couple different vertebrae next to each other, and you're asked to identify which one's lumbar and which one is thoracic. The transverse processes have transverse costal facets, except T11 and T12. And these two vertebrae are what we call floating ribs because they don't come around all the way to connect with the anterior sternum. So we see the traditional transverse processes, a thicker body, but again, not as thick as in the lumbar, the intervertebral disc, which is fibrocartilage, and again, a superior articular process with a facet on it. For the lumbar vertebrae, it's L1 through L5, sometimes described as the small of the back. It receives the most stress. That's why the bodies are massive and why there's oftentimes herniations to these intervertebral discs that act like shock absorbers. Other characteristics are that they have thick pedicles and lamina. They have a flat hatchet-shaped spinous process, which again is why the spinous process looks like the head of a moose. And the orientation of the articular facets locks lumbar vertebrae together to prevent rotation, but it does allow for the extension and flexion. And remember, the body is the thickest, and we can see the articular processes here, as well as the traditional transverse process. When we look at the very bottom of the vertebral column, we can see the sacrum as well as the coccyx, which is 4 fused vertebrae. Remember, the sacrum is made up from 5 fused vertebrae, and it has a superior articular process that articulates with L5. It articulates inferiorly with the coccyx and laterally with the hip bones at the SI joint. And remember that the hip bones are part of the appendicular skeleton. The coccyx is the tailbone from 3 to 5 fused vertebrae, and it has very little function. Now, moving on to the next part of the axial skeleton, we have the thoracic cage. The thoracic cage is made up of the sternum and costal cartilages, which remember is a type of hyaline cartilage that you have learned about previously. The thoracic cage also has the ribs laterally. Its main functions are that it protects vital organs like the heart and the lungs, supports the shoulder girdles and the upper limbs, and provides attachment sites for muscles of the neck, back, chest, and shoulders. So when we zoom in here, we can see the sternum has 3 main parts to it. The manubrium, which is this region here. Then there is the body of the sternum, which is this region here. And then at the base of it is a region called the xiphoid process. Attached to the sternum is the true ribs, which are ribs 1 through 7. And they're called true ribs because they have a direct attachment to the sternum. Then there's the false ribs, which are 8 through 12. And of those, 2 of them are the floating ribs. Looking at the sternum itself from a sagittal view here, we can see the heart shown, the xiphoidsternal joint, which is where the xiphoid process connects with the sternum. So the sternum is also called the breastbone, but we need to use sternum in this class. So it's made up of the manubrium, body, and xiphoid process. The xiphoid process remains cartilage until we get to about age 50. And the manubrium articulates with ribs 1 through 7. Body is ribs 2 through 7. And our next slide is a homeostatic imbalance where the xiphoid can project posteriorly in some people. And due to a blow to the chest, we call that chest trauma, the level of xiphoid process, it can actually push the xiphoid process into the underlying liver or the heart, causing massive hemorrhaging. So during CPR, the hands must be positioned on the midsternum to avoid breaking the xiphoid process and damaging underlying organs. A lot of times during CPR, in fact, ribs are broken. This slide is showing our ribs, and as we know, there are 12 pairs of ribs in males and females. They all attach posteriorly to the bodies and the transverse processes of the thoracic vertebra. The first 7 pairs of ribs are true ribs, which are called vertebrosternal. That's because they attach directly to the sternum because of this costal cartilage that we see here. The false ribs are pairs 8 through 10, and they are called vertebrochondral. And as we know, chondral means cartilage. Remember, a chondroblast or a chondrocyte. And they're called false ribs because they attach indirectly to the sternum by joining costal cartilage from above. So you can see that in these here. And then finally, the last 2 are the vertebral or floating ribs because they have no attachment to the sternum. So again, we have true ribs 1 through 7, so 14 total. We have false ribs 8 through technically 10, and then 11 and 12 are floating ribs. You can see the costal cartilage that's between the rib and the sternum, and the parts of the sternum, which are the manubrium, the body, and the xiphoid process.